Hello and welcome to another exciting episode of Through the Able Eye, a podcast to educate and empower families of children with special needs. Today is a very interesting episode, especially on heart health of our young children. And to do this, we are honored to have Dr. Virender Sethi, who is a former chief of interventional cardiology and vice chairman of cardiology at Hackensack University Medical Center. He has an experience of over 50 years in the field of cardiology. So we are really honored to have Dr. Virender Sethi. A very warm welcome to you.
Thank you. Thank you for inviting me. It's a pleasure.
In this podcast, we are going to discuss various aspects of what are the conditions of heart health, what are the early signs which parents can observe and identify. Because, as it's always said, that if we can identify an issue in early stages, there are chances for full recovery. Especially in case of neurodivergent cases like autism, ADHD, Down syndrome, what are the higher risk factors related to heart health? So we are also going to talk about how nutrition and physical activity play a role in the heart health. And in the end, we will touch base on the various research and the latest advancements in heart health and how it is helping our young children. So, Dr. Virender Sethi, let's begin with the fact that how's the normal structure of the heart?
So, the heart is structured in such a way that there are two sides of the heart. One is the right side, and the other is the left side. And there has to be complete separation. In other words, there has to be a complete wall between the right side and the left side because the right side brings the blood back to the heart after it has gone through the entire body. So oxygen is already extracted from the heart.
Right,
So when that blood reaches the right side of the heart, it is somewhat bluish in color because the oxygen is out of it.
right,
Then it is pumped in the lungs by the right side of the heart. It returns to the left side of the heart where it is now fully oxygenated because it received all the oxygen from the lung, and it is now pumped all over the body so that body can receive the oxygen. It is very important that there should be no restriction in pumping of the heart. So in other words, all the valves in the heart, they have to be functioning normally.
right,
Second thing is that it has to be a complete separation of the blood. There cannot be admixture of the blood. So that is in relationship to what we are going to be talking about the heart defects in children.
right. So, when we talk about common conditions in your practice, what are the common heart conditions you have observed, especially in young children?
So I think there are many conditions, and you look at this way that there are in certain conditions, child grows almost normal to a certain extent. And then there are conditions in which the child suffers from very early on, and you can notice, and the parents can notice. For example, if there's a mixture of blood
Mhm.
because of a septal defect in other words, the wall is has a hole in it, and the blood is mixturing. So in that situation, the oxygenated blood is traveling and mixing with the non-oxygenated blood. In other
Right,
words, the blood which is blue.
right,
So, in that situation, it is expected that up to a fairly uh, large part of the life, they will grow normally unless the defect is so large. And that situation is very similar to one of the more complex defects.
right,
So, what happens is when these are the conditions where there's a hole in the atria, which we call as atrial septal defect, which means upper chamber.
Right.
There's a hole in the ventricle that we call as ventricular defect, and there's a hole or connection bet- between aorta and pulmonary artery,
Mhm.
which we call as PDA or patent ductus arteriosus.
Right.
These are very treatable condition, easy to treat. Most of the time, you may not require surgery.
Okay.
They can be corrected with that, but they must be detected before they cause damage to the lungs. So
Correct.
they should be detected as early as possible. Then there are some conditions which are much more complex. These are basically blue babies.
Okay.
They're born and they're blue because the blood is coming from the right side of the heart and mixing with the left side of the heart.
Right.
So these are somewhat difficult to treat, but they must be detected early because the treatment is available. So these are the conditions in which the blood is being shunted from the right side of the heart to the left side of the heart.
Right.
So it is important to detect. And then I must say that there's another um, type of defects which are seen in children
Mm-hmm.
where they have electrical abnormality.
Okay.
After all, heart is functioning because the electrical current is making the heart beat.
Hmm.
Sometimes the children are born with a defect in that type of
Okay.
condition in which they can suddenly die. And there are
Okay.
medications available,
Hmm.
and there are other things available, which are like a pacemaker or defibrillator available for these children. They can be treated from early on. The child can be born with a where he's not producing the electrical current at the rate of 70 per minute, but is producing at the rate of 30 to 40, and
Hmm.
they require pacemaker. So those are some of the conditions that I just mentioned,
Right.
and they're all practically treatable.
Wow. So now that we understand the various conditions, how can a parent identify these early signs so that they can take action? Because sometimes uh, a, a pediatrician may not be able to understand. So, can parents observe these various conditions? Can they identify those sounds so that they can identify this early?
Yeah. So some of the conditions parents will not observe because they're not affecting the child at that age. It
Right.
is the job of a pediatrician
Hmm.
in that situation to listen to the heart of the patient carefully. Maybe there's a reason to listen carefully. Maybe the mother had diabetes. Maybe
Okay.
the mother was taking alcohol during pregnancy. Maybe the other mother was taking drugs during the pregnancy. Drugs by means illegal as well as legal
Yeah.
drugs, which can cause that. And those are the conditions in which the pediatrician should be aware of that and should be listening. Now, then there are conditions in which parents will be observing my child is not growing normally. What is wrong with that? My
Right.
child's growth is stunted. Then there will be the mother will notice that my child is breathing too fast. Why is he breathing too fast in comparison to the other children that either I had before
Mm-hmm.
or my neighbor's children or my children in the community? Why is my child getting tired very easily?
Right.
These are the things that the mother observes and then takes the child to the doctor. Most important thing from pediatrician is there's a technology available which can readily diagnose this condition. It
Oh.
is so simple
Hmm.
that all the pediatrician has to do is an order a test, and
Okay.
within 20 minutes that test is performed,
Hmm.
and it is simple. It can be done in a doctor's office. It can be done in the hospital. So it's the suspicion that my child has something wrong,
Right.
either on the part of pediatrician or in the part of the parents that there is something wrong with my child, and that is most important thing.
Right. So, doctor, as you said that, even the rate of progress when the child is not in a typical range of development, but in case of neurodivergent cases, so cases like autism, cases like Down syndrome, where already the rate of growth is affected, in that situations, what are the higher risks for heart issues? How can
So,
a parent identify the heart health in those situations also?
so if a child has, for example, Down syndrome or autism,
Yes.
automatic. It's all automatic. It's a like you order immediately those tests. Don't even wait for that. So the pediatrician says, wait a minute, this child has Down syndrome, this child has autism, this child has cerebral defect. Right away, you suspect, and whether you suspect or not, you will order those tests. It is the job of a pediatrician there. I mean, sure, once you diagnose a Down syndrome, you must order an ultrasound examination of the heart immediately,
Okay.
because that's how you diagnose, that's how you treat. That's what the 21st century medicine is. Yeah,
So can you name those tests? Because as you said, it's just a 20 minutes test and easily can be easily done.
right. So there are two most important tests. One is a simple electrocardiogram, which is done in a doctor's office,
Okay.
and that is an easy to perform, and that will tell you that whether there is right side of the heart is enlarged or the left side of the heart is enlarged. That's really, or the child has an irregular heartbeat. Those are three conditions that you're looking in electrocardiogram.
Okay.
I mean, the other conditions, don't misunderstand me,
Hmm.
but as a common things that I'm talking about. So these are the common thing is that you look at the cardiogram, or you say, wait a minute, the right side of the heart is enlarged, something is wrong. You look on the left side is enlarged, there's something wrong. Oh, this child has irregular heartbeat. It's not normal heartbeat. So then you order more tests. The most important thing, however, the biggest advancement in, I would not say only in cardiology, but in medicine in general, has been the ultrasound examination.
Okay.
So, ultrasound examination in case of the heart, we call it echocardiogram. That's
Okay.
all it is. But it's the same ultrasound examination because for the heart, it is a moving organ because constantly beating. So that's why the echocardiogram is done in many dimensions.
Okay.
And so echocardiogram is the most important test that is performed.
Okay.
And only when you detect something wrong on the echocardiogram, then you may or may not perform cardiac catheterization. The reason you may not perform is the echocardiogram, as I said, is the biggest advancement. It gives you the entire structure of the heart. You can look at the holes in the heart. You can look the connections in the heart, whether they are normal or not normal. You can look um, if the if there's a hole, you can also look at how much blood is mixing.
Right.
So that in itself is such an advanced technology
Hmm.
that in babies we are performing not that many cardiac catheterization as I used to perform 50 years ago, because that was the only way of diagnosing it at
Oh,
that time.
okay.
So, and this is a non-invasive test because that is the most important part of it. Nothing is done to invasively. In other words, you're not entering the child's body. All you're doing is taking a probe, putting it on the chest. It sends the ultrasound signal
Hmm.
that gets reflected from the heart,
Oh,
and it is recording as a full moving image on the television camera. With the television camera, you
right.
can see almost everything.
Wow. Wow. So now my next question is related to the nutrition of a child. Now, there are two conditions. One, heart conditions can be congenital, and the other, there can be certain reasons because of which the heart conditions may arise. So, what is the role of nutrition in terms of heart health?
Yeah, I think this is a perhaps is the most important question in relationship with the parents,
Right,
that how do I maintain the proper nutrition of the child? Number one, the child is in a growing age. He needs a lot of nutrients.
right,
And you got to make sure that they are being given adequate vitamins, adequate milk, milk products, and the proteins,
right,
and cutting the amount of carbohydrate and fats to the child, which they don't need that much. The most important thing is, I mean, you certainly need a balanced diet. I'm not saying that you don't need fat and you don't need carbohydrate, but I think particular emphasis has to be made that they're getting proper nutrition. Fortunately,
hmm,
in India, today there's no shortage of food.
yeah,
In fact, there may be too much food,
mhm,
and maybe we are feeding the children not the proper diet.
right,
So I think look at this way. In addition to that, the diet, we got to make sure the children are receiving proper vitamins.
right,
A lot of population in India is vegetarian.
yes,
So they do not get the proper amount of proteins. That's why I emphasize so much on the proteins,
okay,
because most of the proteins they come from animal sources. But
yes,
milk is a source of protein,
right,
and we got to make sure that the children are getting adequate vitamins.
right,
Uh, Now, I think the reason I said it was earlier on that it is the most important question
hmm,
is now you can do the lipids, and you can do the test for the lipids in the blood for children,
okay,
especially those who have family history of heart disease.
right,
Maybe their father or mother or uncle or aunt had a heart attack at a young age of 30, 40.
hmm,
You check their cholesterol. Make sure that cholesterol is normal.
okay,
If it is not normal, if it is abnormally high,
hmm,
then you control with the diet. If the diet alone does not work, then there are medications which are available, and that is those medications are prescribed if diet alone is not adequately protecting the child. This is important because the child is growing. He's
right,
going to be one day at the age of 40, 50, and you want to make sure that he does not have the same disease that his mother, father, uncle, aunt, or one of the relatives had. So that is called the prevention. And the same thing, by the way, applies to the prevention
hmm,
so that the child does not develop the congenital heart disease. The mother has to take care when she is pregnant.
right,
If she has diabetes, she has to have treatment for that to control the blood sugar. If she's a smoker, she should not smoke during pregnancy. Alcohol is another thing. The vaccines, especially the rubella vaccine,
yes,
which is known to cause defect in the children, they should be taken not only from mother, but maybe the other people who are going to be handling the child. So
right,
these are important things that we tell the people to take care of.
right.
And
So,
take adequate nutrition also.
yeah.
Mother should be taking folic acid and things like that so that the child is not deficient in vitamins.
Yeah, so my question was related to this only, that when you talk about nutrition, now there are a lot of health drinks which are coming up, a lot of powder in a powder form, which uh, the brands say that if added in milk, it enhances the nutritional value of milk, or there are some protein powders also. Do you think children should be given these kind of supplements in the with their milk? What is your personal uh,
I think
opinion?
that is where a doctor comes into the picture. I personally think that there's adequate things available in the food. You do not have to add these supplements.
Okay.
I think the supplements are to be added only under direction of the doctor.
Okay.
That really, if he's not getting, I think even most doctors will prescribe not these powders and things like that,
Hmm.
but they will tell them take a balanced meal. If you're short of protein, they will tell you how to supplement the protein. Egg is a good source of protein.
Yes.
Meat's are good. Fish is good. And so those the things that you will take for protein supplementation. Then they will tell you that if there's a shortage of, if not shortage, if there's not adequate vitamins and all that, they will prescribe those things. I think to just simply go on these commercially available products, because remember, there's a commerce behind it. Somebody's promoting it.
Right.
So I think it is best is to do only those things which are advised the physicians, and I can tell you most physicians will not advise those.
Right. So, apart from nutritional value in the food, what is the role of physical activity? Because I, being a therapist, I feel the cases of speech and language delay have increased many folds in last 2 3 years because of increase in screen time in children. So do you think that's the more sedentary life in children because they are most of the times on screen is also affecting their heart health?
I definitely think so. I think the children are not physically doing what they should be doing. There was a time when the children used to play all the time in the playground.
Yes.
Now they have this device in front of them, and they're uh, mostly spending time in that,
Yes.
whether they're playing games or they're talking to some of their friends. And I think there's already a movement, which I'm not sure whether you heard it, that New York City has banned the use of telephone in the school. A child cannot carry it. It's just started.
Wow.
And I think there is a reason for that. They're not paying attention. They're not doing enough physical activities. So, I mean, these things are available to them. They're easier.
Hmm.
And you, parents, will find that it is very hard to compete with what is available on that handheld device to get their attention.
Yeah.
So it is better to stop it early
Right.
and to control it and put time limits on them. And
Right.
there are these devices also have where they can be controlled by the
Right.
parents,
Right.
and I think that should be done. Physical exercise is very important for a child.
Right.
Um, there should be physical exercise prescribed by the schools. There should be activities in the schools that they do physical,
Yes.
exercise. There should be hours for physical training
Hmm.
in the schools.
Hmm.
The children should be playing in the playground, and that is very important,
Yes.
rather than sitting and holding that handheld device. Yep.
Correct. Yeah, it's because now both the parents are working, and so they need someone to take the child to outdoor activities, and that's the reason that children are being restricted at home most of the times because none of the parents are free to take their children outside. So that I think balancing of time management and all those things play an important role because heart has to go long way as you said.
I think fortunately in India, there's still grandparents
Yes.
who can help them,
Yes.
which are joint families are non-existent in the Western world.
Right.
India still has joint families, or the parents are living close by. They are ready to help. They will pick up the children from school. They will do all sort of things that they can help while mother and father both are working. That is the reality of life today. It is hard to meet expenses unless both parents are working.
Yeah.
But as I said, there is a solution for everything.
Hmm.
I think these parents have to think about it.
Right.
Where is the solution lie? Where that my child is getting adequate exercise and things like that.
Right. So, coming to the last segment, Dr. Sethi, what is the latest advancement in pediatric cardiology? What would you like parents to be more aware about now?
So let me put it this way. I don't think I've touched on this aspect.
Okay.
I did mention that a child is born, mother suspects the heart disease, doctor suspects the heart disease, and an ultrasound examination is done.
Yes.
I did not touch upon the fact that an ultrasound examination can be performed while the mother is still carrying the baby.
Oh,
In
okay.
the first 3 months, right at around 3 months, you can perform the ultrasound examination. You can see the heart defects at that age
Oh, okay.
while the baby is still being carried in the womb.
Wow.
And at that time,
Mm.
and these should be done by the people who are experts in doing these, not an ordinary sonographer.
Right.
There are sonographers who are expert in doing these. They will view the heart in many different views, and then they can give an option to the parents that listen, your child is going to be born with multiple very complex defects in the heart.
Mm.
Do you want to carry the pregnancy?
Right.
There will be a huge cost to you and to your baby who's born because he's going to have very complex defects,
Right.
but requiring multiple operations, may not survive that, and will even after survival may not have a normal life. So you got to make that decision at that early where a pregnancy can be terminated easily.
Right.
So that's why, and naturally you don't do it in every person, but you do it in those people where you suspect that there is a high likelihood of a defect in the heart,
Right.
child being born with a defect in the heart. So in those situations, you perform these ultrasound, and the doctors suspect that mother has diabetes, bad diabetes, requiring insulin. Mother has been a smoker.
Hmm.
Mother's nutritional status is very poor.
Right.
Mother has been exposed to the chemicals, the drugs,
Hmm.
which can cause genetic mutation. In other words, the chromosomes may break or have defects, and they can give high likelihood of a child born with the defects. So that is one major advancement. And the second other major advancement is that nowadays the children can have simple heart defects closed without an operation.
Oh, okay.
There are catheters that you put the catheter in the heart, go through the hole, and you put an occluder. In other words, there's a thing which opens like an umbrella,
Oh, okay.
and it opens on the two sides and it sandwiches the wall which was not which was supposed to have not a defect but now has a hole, and that hole can be closed.
Right.
Similarly, there are plugs available which can close if there's abnormal communication
Right.
between an artery from the right side with the left side. So you can plug those. There are pacemakers available which can be given very early
Okay.
for a child who has a heart defect,
Right.
and then they will have a normal growth
Right.
versus an abnormal growth.
Right.
Um, and what you're doing is you're preventing these simple defects becoming complex by damaging the organs. So that's what you're doing with these technologies. And there are many more to come. There may be technologies in fetus
Hmm.
which may be um, curable.
Right. Wow. Awesome. So as we move towards the Gen Z generation, they have the medical facilities are improving day by day. Very nice.
Yeah, I think they will be improving more and more.
Yes, especially AI coming and playing a major role in various medical field and that in surgeries as well.
Yeah, yeah. AI is going to be AI is going to may take uh, some of the roles of the physicians,
Right.
and perhaps the biggest role of AI will be in the development of the drugs and materials with which you can close these defects.
Wow.
Yeah,
Great.
yeah.
So very informative. Any message you would like to give to our parents in the end?
Yeah, my message is to be to try to raise the child with the best nutrition, good exercise, good mental health.
Hmm.
Talk to them. Very important is to talk to the child and listen to them,
Wow.
because and then they will start listening to you. So I think parents are the most important part of a child's development,
Yeah.
and I think it is important for them to be part of their life, even though they both may be working.
Yeah.
But there's a lot of time beyond that.
Right.
They understand my parents have to work.
Yeah. True. With that note, thank you so much, Dr. Sethi, for taking out time and giving us so much information about heart health. And as you rightly said, the heart has to go on and on. So I'm sure with this conversation, parents take away key points like taking care of good nutrition, identifying early defects, doing diagnosis on time, and yes, having a physically active child, involving them into physical activities. So, all these aspects, and of course, using latest technology now available to identify these certain situations much early in infancy. All these points are the key takeaway from our conversation. I'm sure parents have enjoyed it. So, thank you so much for being with us and educating and empowering our families.
It's
Thank,
my pleasure.
thank you so much.